Okay, the first measurement is X-ray, so using electromagnetic energy with a wavelength of 0.05 angstrom and the 100 angstrom. The energy can pass through the body and indicate relative tissue density on a photographic plate. Or now, of course, we use camera to record the transmitted radiation. This can be used then for cerebral angiography, the imaging of inside of the head, and cranial X-ray, as well as for brain scans. Ultrasonic equipment, although it is not that popularly used for brain analysis, but it can also be used nevertheless. It can transmit high frequency sound wave with a 1 millisecond burst at 2.5 megahertz frequency and pass into the body and indicate tissue location by reflecting waves. Basically, this is similar like the ultrasonic equipment used to image other parts of the body. But if it is used to image the brain, we call it as echoencephalography. Then, of course, electrophysiological equipment using electrodes to detect the bioelectric signals coming from the brain and the nerve system as well. Because as we know that in brain or neural system, there are transmission of ions and charges between one cell to the other cells, a neuron cell to the other neuron cell. And using these electrodes, we can detect this low voltage and low frequency bioelectric signal picked up by the electrode. Example will be EEG, electro.
Hello.
Hello? Yeah. Okay. Yes. Were I frozen that for some while? Was I frozen my screen? Because I cannot move my mouse. Okay. Let's continue. No, it's frozen again. No, wait. Yeah, this is a sign that I need to change my computer. Okay, one moment. Okay, it works again. Okay, so EEG. Even though previously most of the use or application will be for diagnostic purposes, but now it spreads also for example, BCI, brain-computer interface. Used, for example, to interface our brain with other devices or with our environment. Can also be used for for game purpose, or for people who have disability to control particular device or equipment using using their brain wave signal. Okay, let's try to discuss one by one this instrumentation. First one is cerebral angiography. So this is used to image the blood vessels of the brain and the blood flowing through them with the aid of a contrast agents. The radio opaque dyes that block the X-rays are injected in an artery. So this will block the X-ray. So then that artery will be able to be seen, can be seen from the X-ray image. Otherwise, then it will just be transparent, right? Because it is soft tissue. And this radio opaque dyes will disperse through the cerebrovascular tree, so that X-ray images will reveal any blockage or tumors in the artery of our brain. Then the advantages of this technique, cerebral angiography, is it is mostly accurate and precise, and may be used to get more detailed information after the patient conducted MRI or CT scan. Other purposes, it is used to confirm brain tumor, to evaluate the arteries of the head and the neck before the surgery, and find a clot within our brain that may cause stroke. For example, if I'm not mistaken, our current Ministry of Health, Dr. Terawan, is one of his expertise before he became minister is actually to do this angiography, cerebral angiography, to detect any blockage of the artery until even the brain. And not only that, he implemented an interventional angiography technique to spray an anti-clot agent, yeah, so that then to clean up that blood vessels. Although it is not yet entirely maybe accepted by the radiologists or by other neurologist society. The abnormalities that can be detected by cerebral angiography, among others, are abnormal blood vessel. For example, if we have vascular malformation, aneurysm, something like this, yeah, like a big clot, yeah, of, of blood. Narrowing of the arteries in the brain, yeah, then the artery got blocked, for example, by cholesterol or other things, so that then it gets narrow. Then also to detect vasculitis. So this is how the image look like in cerebral angiography. So catheter is being inserted into the artery and to spread this agent, the radio opaque dyes, and then the image, the X-ray image, can detect this agent, yeah, reflected by or scattered by that agent, and then the artery can be seen through in the X-ray images. So, however, there are some complications that can be made possibly happens during cerebral angiography. Bruise where the injection was given. It may cause some allergic reactions to sedative or pain killing, yeah, dye or anesthetic drugs. Although this occurs rarely, it may cause also stroke, and artery at the injection site can also be damaged because of the catheter being inserted there. Then there is another technique called as the cranial X-ray. So basically, this is the X-ray of the bone, yeah, that cover our head. 2D X-ray exposure taken of the cranium. This is used to indicate fractures in cranial bones, blood clots or tumors inside the cranial bones. The disadvantage, however, is it is difficult to read the exposure. Yeah, because mostly in the bone itself, the density difference is not that much. And you cannot also see the soft tissue. So, for example, here's the lateral view of an infant. This is the frontal bone, the maxilla, yeah, the upper jaw bone, the mandible, the lower jaw bone, parietal bone, the temporal bone, and mastoid bone, air cell, occipital bone, and the cervical vertebrae. So that is why this requires another specialization, yeah, in the medicine department as the radiologist in radiology, because it is not that easy to interpret the image. So one of our role, maybe as biomedical engineer, yeah, I believe that you have you learned image processing in semester 7, yeah, I think in semester 7 you'll be learning image processing. So one of the role that you can play, for example, to recognize the X-ray coming from the X-ray image coming from such technique, and then trying to interpret, and then you can implement, for example, machine learning or other image processing technique, yeah, to interpret the result from the cranial X-ray imaging. Then the third technique is computed tomography. In this case, that we have explained a little bit this part maybe in the previous slide, in the previous session, that a three-dimensional image of the body is reconstructed from 3D, from two-dimensional slices, yeah, image slices, then within this rotating X-ray structure. So X-ray beams creates the 2D images from 3D body structure, and then it collects from different angles. From there, it will reconstruct the three-dimensional image of the 3D body structure. So collect many transmission measurements through the patient at different position, and the X-ray is directed to the body, and different body parts will absorb the X-ray at different degree. So then the attenuated X-ray will then be detected by the detectors. Yeah, as usual, the bones will reflect the most, so it will appear as white. The soft tissue will absorb a little bit, then will appear as gray, while the air will absorb much, so it will appear as black. So this is the computable tomography, the CT force field scale, the water density at the value of 0, which one? This one, at the middle, with air and bone at opposite extreme of -1000 to +1000. So the color associated with these density values can be reassigned to highlight particular tissue. This is the process called as windowing. Okay. So we have, this is from the scale, calibrated scale. So based on the scale, we can interpret the image that we have obtained, and then to know whether that part is bone or air, etc., or water. So this is the basic principle of CT scan. For example, it can work like this. This is linearly. This is this one. This is the X-ray tube. Okay, using a collimator, and then the transmitted image is obtained in the other side of the head using a scintillator detector. Then this one is rotated. Yeah, this platform is rotated. The whole platform is rotated. The X-ray and the image is rotated to image the head from different angles. Yes, and then from there, then the image is used, is reconstructed using computer-based system. There are 3 steps in forming the CT images. So the first one is scanning, as we have mentioned, at different direction here. The first scan, and then moving at the other angle, scan again, the other angle again, until it comes back to the original position. After that, it is being reconstructed as digital images, then being converted back to your monitor, with a DAC, and then appears as the image of your head. Then this is the translation and rotation principle using pencil beam X-ray, detected at the other side. And then when it rotates like this, so it will miss. So at different angle, it will obtain different image based on the projection at that different angle. Then if we use narrow fan beam like this, so in pencil beam, it's just one single line, like that straight line. In narrow fan beam, this is the source. The source will give line at different that spread at different angle, at certain angle. Then it could also be wide fan beam when the angle of the spread of that X-ray beam is wider. Then using wide beam, you can have the stationary and rotation. This is the stationary detector array, and the tube, the source rotates, and then this detector will capture the image at different angle. Or we can do this the scanning, the detection by using helical or spiral method. So the table translate like this. So, and the detector and the source is rotating along the table while the table is moving in translation, so that the obtained image is basically forming a spiral projection of the body. And we can have also multiple detector arrays on the other side of the body, so that then from there, using some mathematics in image processing, we can reconstruct the image of the. Some CT artifacts that may occur during computed tomography is, one is motion, of course. So ideally, the patients, the subject should remain static, not moving at all. But of course, this is impossible, right? The subject will always move, maybe a little bit moving, and this may create some motion artifacts. Other thing is if there are some metal objects inside your body, maybe you have implant or other thing in your pocket, etc., that may become metal artifacts. Then beam hardening. This is when small amount of hypodense brain tissue is immediately adjusted to the dense bone. Partial volume arises when the image area contains different types of tissue. Yeah, for example, brain and bone at the same uh, area of image. An intermediate depth density will be represented that may have the appearance of blood. So this may create some artifacts and confusion in the interpretation of the image. So this is how it looks like for each of the artifacts. This is motion artifacts because the subjects move a little bit, right? So it appears like the head has additional volume, yeah, because of the moving motion of the head, something like similar like this. So this beam hardening effect, what is when we have small amount of hypodense brain tissue, yeah, like this near the bone. So it appears like it is the addition of the bone, while in fact it is brain tissue only having a little bit higher density compared to the other parts of the brain. Then partial volume artifacts, yeah, this is when the image area contains different types of tissue, not only the bone, but also the brain, blood vessels, etc. The advantage of CT scan or computed tomography scan is, of course, it is painless and different than angiography. In angiography, a catheter is being inserted into the blood vessel, right, to spread the radio-opaque dye, so which is quite painful. So with computed tomography, nothing is being inserted, so it is painless, non-invasive, and quite accurate as long as, of course, those artifacts mentioned in the previous slide is they are limited there. Ability to image and provide detailed images on the bone, soft tissue, and blood vessel. Examination are fast and simple. Cost-effective imaging tool for a wide range of clinical problems. However, it is also less sensitive to patient movement than MRI. In MRI, it is more sensitive to the motion of the patient. CT can be performed if you have an implanted medical device of any kind because it is X-ray, right? While MRI, if you have metallic implant inside your body, then you cannot even go inside an MRI room, yeah, because you will be stuck to the magnets there. Okay, so be careful if you have any metallic implant in your body, you cannot do any MRI. CT can be performed if no radiation remains in the patient's body afterwards. X-ray used in CT scan usually have no immediate side effects because of the low intensity. Yeah, because low intensity because it is being rotated. Yeah, and then the body is in longer exposure compared to the two-dimensional X-ray. But however, the intensity is lower than the conventional two-dimensional X-ray. Then how can we get good image? Because we scan in 3 dimension and then we reconstruct the image also in 3 dimension. The risk for CT scan is that it is not suitable for pregnant women and maybe an increased lifetime risk of cancer if you do CT scan, of course, many times. EEG. So EEG is using, as we mentioned in the earlier slide, we use electrodes to measure the brain electrical activity by putting electrodes on the scalp, yeah, on the bones of the head. It measures voltage fluctuations resulting from ionic current flows within the neurons of the brain. The transmission activity of millions of cortical neurons will produce an electrical field, and the amplitude is very small usually, yeah, from 40 to 100. I think it's supposed to be microvolt, yeah, not just volt. Frequency range is 0 to 100 Hz. Because in EEG, you really need to have a good amplifier, yeah, compared to ECG, for example. EEG is weaker, yeah, in terms of signal compared to EMG, and let alone compared to ECG. So how does it happen? Yeah? Electrical charge by the neurons, as we have mentioned maybe in the sensor and measurement class, yeah, last semester, there is electrical charge built up in the neurons. This charge will constantly exchange ions with the extracellular surrounding. Then the ions will repel each other, push out many neurons in a wave, and this neural electrical charge. The ions will reach the electrons on the scalp. Eventually, it will go to the outside part of the scalp of the head. Then it will push or pull the electrons on the metals of the electrode. The difference in voltage between any two electrodes then can be measured using voltmeter, a sensitive voltmeter. Recording of these voltages over time will give us the electroencephalogram. So the EEG electrodes can be made from disposable electrode, gel-less, and pre-gelled types, or reusable scalp disc electrodes. Yeah, having a gold, silver, stainless steel, or silver chloride. Yeah, similar like ECG or EMG electrode, or tin headbands and electrode caps. Yeah, to conduct multi-channel recording with a large number of electrodes. And usually, yeah, with EEG, you usually do multiple numbers of electrodes, not just a pair of electrodes, but many electrodes. Because then, so that then you can really map the activity of the brain during particular mental or physical activity. So this is how it looks like. This is, I think, headband. This is the disc electrode. This is headband electrode caps with multiple channel recording. And the EEG electrodes can be saline-based electrodes, what we call as electrocorticographic, or needle electrode sphenoidal, like this. Implanted under the skull with minimal invasive operation, like this. Okay, needle electrode, or like this is saline-based electrode. So these are some of the EEG recording modes. The first one is bipolar mode, yeah, measuring at two different poles. Unipolar mode, single one. This one will be the reference, and then measuring the other in reference to that particular reference site, and then averaging mode, average mode. Like this. Electrode placements can be 10 to 20 methods. Yeah, with for example, with 20 methods, that will include 19 electrodes plus 1 ground. So these are some of the sites, location, or points within the scalp to put the brain, to put the electrode there for the EEG. So these are the location symbolized with an alphabet and number. Nation is the part of the face, Inyon is the back part. So this particular place within the head represents different emotional or intellectual or physical ability. Yeah, for example, here let me zoom out first. Yeah. So the the front part, yeah, FP1, FP2. FP1 is for focusing or attention. FP2 here is judgment, for judgment, and restraint of impulses. Here F3, a little bit in the middle, is for motor planning. The left brain part a little bit in front is for verbal expression. F4 here is motor planning for left upper extremity. So usually our right brain will control the left left limb, yeah, left side of the limbs, the left hand and left leg. The central of the brain here is represent sensory motor integration. Okay, the C4 is sensory motor integration as well for the left limbs, yeah, the upper and arms and hands or extremities. So C3 on the other part is for sensory motor integration of the right limbs. The verbal memory is for in the left part of the brain. Okay, remember what we see. Here, FZ represents the working memory or absent-mindedness. Then emotional memory is on the right part, so right brain part. Cognitive is in the middle, a little bit behind. So P4 here is for cognitive processing also, math problems, and non-verbal reasoning. So more of feelings, etc. So T6 a little bit on the back is for emotional understanding, motivations, and Asperger's. T5 on the left side, yeah, is for verbal understanding. Then P3 here, cognitive processing, verbal reasoning. Visual processing is on the back side of the brain. If you want to remember, first you have to see it. This is visual understanding. O2 here is for visual processing as well. Yeah, occipital lobe. Yeah. OZ here for incontinence, yeah, at the back, in the Indian part. One half in between T5 and P3. This is the part where it is critical for reading. Then this is 1 inch below T5, yeah, and this left part is for spelling. So F here stands for frontal lobe. T is temporal lobe, yeah, temporal lobe at the side. C is central lobe at the middle. P parietal lobe at the upper back a little bit. And O for occipital lobe at the back side. And Z is for the midline. Yeah, this is the midline. So these are the parts if you want to detect different activities of the brain, and you can detect in using these electrodes placed at different parts of the body of the head. So EEG for diagnosis application can be used to monitor alertness, coma, for example, or brain death. It can be used also to locate areas of damage after a head injury or stroke or tumor. Testing afferent pathways by evoking potential. Monitoring cognitive engagement, yeah, by monitoring the alpha rhythm. Yeah. We have alpha wave, beta wave, and gamma wave in for the brain wave. Producing biofeedback situations. Controlling anesthesia depth. So when we are the anesthetic specialist put a person in anesthetic condition, then EEG can be also used to monitor the depth of how that anesthetic drug work. Investigating epilepsy and locating the origin of the seizure. Testing epilepsy drug effects. Assisting in experimental cortical excision of epileptic focus. Monitoring the brain development, yeah, for children. Testing drugs for convulsive effects. Investigating sleep disorder and physiology. Investigating mental disorder as well. Providing a hybrid data recording system together with other modalities, with other, for example, X-ray, maybe CT scan, etc. So this is one of an example of electroencephalography, EEG waveform. Yeah? It's in the millivolt range, right? So this is when the stimulus occurs, and this when the depolarization occurs between neurons to neurons, and then repolarization occurs. So repolarization occurs. Depolarization here means that when the polarity difference between the different sides of the neuron is approaching zero, and after that repolarization occurs, it brings back to negative values, down to minus negative 90 millivolt. Then hyperpolarization occurs here. Then the rest potential is about minus 70 millivolt. I think I have explained this a little bit, yeah, in the sensor and measurement subject here for the biosignal source. Where does the biosignal source come from? Okay. The limitation, however, with EEG is poor spatial resolution. So as we can see from here that what about the area in between these places? Yeah, there is not yet a complete map of the brain. That's why maybe some years ago, President Barack Obama, yeah, he initiated the project BRAIN, if I'm not mistaken, within the National Science Foundation in the United States, to map the brain, to know which part of the brain actually control which action or which cognitive abilities. So why is it still a problem? Yeah, because there is with EEG itself, very difficult to monitor the whole surface of the brain with high spatial resolution. It's improving, yeah, but previously, for example, only 8 electrodes, then increased to 16, 24, maybe until 32 or 64 electrodes. What the many small electrodes, yeah, in the cap. EEG is most sensitive to a particular set of postsynaptic potential. So those generated in superficial layers of the cortex on the crest of gyri directly abutting the skull and radial to the skull. Dendrites have far less contribution to the EEG signal because it is situated deeper inside the cortex. So in EEG, we also only measure the signals on the surface of the brain. What happens, what occurs inside the deep side of the brain, we never know or never yet investigated. For that, we need different techniques other than EEG. For example, currently neurologists use fMRI, functional MRI, to investigate the deep part of the brain. Yeah, similar like MRI enhancing agent is being injected, similar like angiography. Yeah, but this is for MRI, magnetic resonance imaging, and then they can see that particle inside the brain using three-dimensional reconstruction. So example of EEG results for hypnosis. Yeah. High hypnotized person will have high shift from left hemisphere activity to the right hemisphere of the brain. Low hypnotized will have low shift from left hemisphere activity to the right. Imagery. So at occipital signal at the back of the lobe of the head, yeah, definite decrease in alpha activity during imagery task, yeah, when we see image. Meditation, when a person is meditating or praying or whatever, so it creates a stable alpha and theta activity, but never fell to asleep. In a non-meditating group, it revealed K complexes and sleep spindles easily fell asleep. Sensation, yeah, the use of EEG to map which part of the brain is related with sensing. For odor, yeah, real food odors like chocolate were linked to extremely low theta levels and relaxing effects and pleasantness. So basically, if you want, you can collaborate with the food technology department for your thesis, for example, and doing EEG. Now, what they do in the food technology department for sensory lab, maybe some of you have been volunteer for the sensory lab, so they have to taste different food, yeah, and taste whether they have the same taste or not. But this is still qualitative, right? It's not measurable. So maybe as a research technique, you can try if you are interested. After you come back from Germany, maybe as your thesis, some of you. We have EEG, yeah. I think we have EEG electrode. I have to check again with Kak Devita, but we have EEG devices in the lab. So you can put this cap and then measure the real sensation when the subject is conducting sensory tests or analysis, yeah, tasting some food, what wave are being generated. Interesting, right? So when hearing also, sound sensitivity was lower during periods of alpha activity than during non-alpha activity. Normal EEG pattern, the EEG is typically described in terms of rhythmic activity and transients. So the rhythmic activity is divided into bands by frequency: delta wave, theta, alpha, beta, and gamma. Most of the cerebral signal is between 1 to 20 hertz. So this is the waveform for these different types of brain wave. This is the beta wave, yeah, in between 13 to 30 hertz. Parietal, it appears parietal and frontal in the upper part, in the front part. Sorry. Then alpha is here, 8 to 13 hertz, like this. Occurs occipital in the back of the head. Theta here, 4 to 8 hertz at children or at adults during sleeping. The delta wave, 5 to 4 hertz, like this. Infants, occurs in infants, babies, yeah, as well as sleeping adults. So the delta wave, yeah, this part, like this. It has highest in amplitude, but the slowest wave, yeah, that's why it's 0.4 until maximum only 4 hertz. Seen normally in adults in slow wave sleep as well as in babies. Theta wave, so theta wave is this part, 4 to 8 hertz, yeah. Seen normally in young children, and also drowsiness when you get sleepy, or arousal in older children and adults, and also during the meditation. Alpha wave, so alpha wave is this part there, these three different waves between 8 to 13 hertz, occurs in the occipital region of the brain. This is the first rhythmic EEG activity being discovered, known as the posterior basic rhythm, also called the posterior dominant rhythm or the posterior alpha rhythm. Emerges with closing of the eyes and with relaxation. Attenuates with eye opening or mental exertion. So when you're relaxing, alpha wave will generate it. Slower than it hurts in children. Then the last part is beta wave. This is closely linked to motor behavior. So it is attenuated when you are doing active movement. So often associated with active, busy, or anxious thinking and active concentration. Then the gamma wave is represents the binding of different population of neurons together into a network for the purpose of carrying out a certain cognitive or motoric function. So during sleep patterns, when sleeping, EEG form also specific sleep patterns. First is REM, rapid eye movement. This is when dream occurs. Low amplitude and high frequency oscillation. Yeah? So when you are in REM state of sleeping, you know, like this, but inside this kelopak, what is kelopak mata? This eye cover, eyelid. Yeah? Basically, your eye moving a lot. You are moving here and there. It's low amplitude, high frequency oscillation. You produce similar wave like wakefulness, beta wave, while actually you are sleeping. Okay. In non-REM resting, your brain will produce high amplitude and low frequency wave, or the delta wave. One passes through the 4 stages of non-REM during the first 30 to 45 minutes of sleep, and REM sleeps occurs after the 4th REM and non-REM stage has been achieved. So remember that about the quality of sleep. The quality of sleep happens when you already reach the REM stage of sleeping. Yeah. This is also interesting topic, yeah, for research. Yeah. So if you are interested, and for your thesis, we can do research on EEG for detecting restfulness and wakefulness. Your subject will be asked to sleep, yeah, maybe something like that, and then you detect the REM wave. Interesting. Non-REM sleep, this is when alpha, delta, and theta activity are present in the EEG record. In the first and second stage, the alpha wave are more dominant, and the third and fourth wave, the delta activity. So afterwards, you reach the REM, where then the theta wave will be more dominant. During the non-REM sleep, you have light or even respiration. You still have muscle control, yeah, and you have also already start to have dreaming, but not vivid, not very clear, yeah, and difficult to rouse from stage 4 SWS. So during when we are awake, okay, we are producing alpha and beta. When we start to sleep, stage 1 sleep, yeah, then we produce this one theta activity. Eyes are closed. He starts to relax. Alpha wave occurs. Uh, Stage 2 sleep like this. EMG signal is more irregular with sleep spindles like this. High voltage K complex like this. High voltage bursts, and it's already difficult to arouse. Yeah. When the sleep deepens to stage 3, theta and delta wave appear. This is the delta wave. This is the theta wave. Okay. Then afterwards, the stage 4 is dominated by delta. Sorry, this is the theta and this is the delta. Delta is dominant in the stage 4. Yeah. After that, then you reach REM sleep, where you have the theta and beta activity. And remember, in REM, it's you will generate, your brain will generate similar like beta activity brain. In other words, when you are in REM, you experience dreaming like you are dreaming actively, right? You're very vivid. You are doing things in your sleeping. Yeah. Have you ever felt like this? Yeah, I believe everyone has, right? If someone never has REM, it means that you have problem with your sleeping. You have sleeping problem. Okay. So with when you reach REM, you can, even when you are awake later, you still remember usually that dream. The dream appears so real. Yeah. This is when you are in REM sleep. You have a beta activity similar to wakefulness. Yeah. When you are awake here, you have beta wave. Yeah. So in REM, your brain also generate beta wave. So as if you are awake. So you are doing activity within your dream. So this is how science gets into it. It doesn't get deeper into the secrets and the realities of sleeping and dreaming. It's something else, but it is an interesting subject for research. If any of you are interested, then maybe we can collaborate with psychologists or I don't know neurologists for conducting this sleep research. REM sleep. Yeah, this is the last part here. The beta activity is present, desynchronized EEG pattern like this. Yeah, no synchronization. I mean, with the frequency is more random, and physiological arousal threshold increases. The heart rate quickens during REM. You breathe more irregular and rapid as if you are doing activity, yeah, inside your dream. Brainwave activity resembles wakefulness, as if you are awake within your dream. You are not awake, but as if you are doing something. And also, some genital arousal also happens during REM sleep. So this is due to the pontine geniculate occipital waves, loss of muscle tone, paralysis. You are not able to control your muscles during this REM sleep, but you are doing something activity in your dream. Yeah, that's why you experience vivid, very vivid means very clear, emotional dreams that even after you are awake, you can still remember the dreams. So this REM sleep, the scientists think that they may be involved in memory consolidation. This is one theory, of course, not necessarily this is the true one, but this is now the current theory. But there are many other research on this REM sleep. So this is how the summary of the previous stages during sleep. So when you are still awake like this, and you start to, this is the sleep non-REM. You go to the deep stage 1, step 2, step 3, step 4. Keep going back to the REM peak here. So, but basically you are in deep sleep, but your brain generate beta activity which resemble a wakefulness. And so during one night, during one sleep, you may experience transformation. So to back again to stage 2, stage 3, 4, and then doing another REM. So this may be in the dream, you are moving from one dream to another dream within your sleep. Okay, yeah. I believe you experience this thing, right? So these are the properties of slow wave and REM sleep. And during this is the physical property, and this is the slow wave tip sleep, slow wave sleep, yeah, before REM. The heart rate is slow decline, but during REM, variable with high bursts. Yeah, so sometimes high beat, sometimes slow beat, depending on the activity you are doing in your dream. Respiration also variable with high bursts. Thermoregulation in slow wave sleep is maintained, but during REM sleep is impaired. Brain temperature increase during the REM. So actually your brain is being active, yeah, during the REM. So this is some amazing facts. While slow wave sleep, the brain temperature decrease. Cerebral blood flow during REM is high. So it means a lot of blood is being pumped into the brain during your REM sleep. So similar like you are being awake, but actually you are not awake. So this is the paradox during REM sleep. And the skeletal muscular system progressively reduced. No, during REM sleep is completely eliminated. So it means you are completely relaxed. Your physical muscle, knee jerk reflex is normal, but in REM sleep is suppressed. Fascic twitches is reduced, and REM sleep it is increased. See, in eye movement during REM sleep is rapid, very rapid. Your eye will move here and there, but coordinated. While during the slow wave sleep, before deep sleep, it is still infrequent and slow. In cognitive state, fake thoughts, yeah, this is just before deep sleep. When you go into the REM stage, you will experience the dreams, the vivid, the clear dream. Hormone secretion is high during for growth hormone during slow wave sleep, but during REM sleep is low. Neural firing rate is during the REM is increased firing rate and tonic. Sensory evoke potential is reduced during the REM sleep. So yeah, this is it means that actually your physical being during the REM sleep is very passive, but something in your brain is very active during the REM sleep. So the importance of sleep is, yeah, I cannot emphasize more, is very important for the survival. If you are sleep, what do you call it? You lack some sleep, yeah, in 1 day, 2 days, you will lose all focus and concentration, right? Sleep appears necessary for our nervous systems to work properly. During the sleep, wake and sleep, growth hormone secretion increase, and important for the infants, growth and physical restorative process of adults. So see that one theory in exercise, in sport, I've never heard that, but I cannot give you the reference, but maybe you can search yourself that actually when you are doing physical exercise or sport, yeah, the main benefit occurs when you have good sleep or good rest after you do that exercise. Okay, so because during that time is when your body experience growth hormone will work, and then there will be physical restorative process replacing the broken cells within your body. Okay, so if you do only very hard exercise or sports, but without a proper enough rest or sleep, then basically you are destroying your own body. Okay, and during REM, the brain blood flow and protein synthesis increases. So this is some paradox, what do you call it? Amazing fact. Actually, we expect that during the REM, the deep sleep, our brain does not do much activity. But on the other hand, our brain do a lot of activity similar like wakefulness during the REM or deep sleep stage. Okay, so this is something which is also maybe still a mystery. Yeah? It needs to be solved or need to be researched further. So daily sleep requirements decline with age. So as you grow older and older, you sleep less and less and less. Okay, maybe while you are still baby, you need 12 hours sleep, 14 hours sleep, or even more, right? When you are children, you need 10 hours sleep. You are teenager, 8 hours sleep. When you when you become older, 6 hours, 7 hours sleep, something like that. Then these are some of the sleep disorder. Insomnia, yeah, this is habitual sleeplessness caused by, for example, excessive noise, maybe can be caused by stress, drugs, medication, pain, uncomfortable temperature, sleep apnea, periodic limb movement disorder, etc. Narcolepsy, unexpected periods of sleepiness during the day. Huh? Are you having this during my lecture? Sleepiness when I give lecture?
No.
Nasser?
No, sir.
No, sir.
Okay.
No, sir.
Yeah. So this is narcolepsy. Yeah. So that's why I get a good sleep. So extreme daytime sleepiness. Sometimes some people do have like this. Yeah. Not necessarily because they don't have enough sleep. Yeah. But just because they have something wrong with their physiological metabolism. Sleep paralysis, hypnagogic hallucination. Yeah, that's why there is a specialist in medicine specializing in sleep behavior. Yeah, sleep. Other sleep disorder, somnambulism, sleepwalking. Anyone have this? I hope not. Okay. What we are speaking this here is from the perspective of biomedicine, yeah, medical engineering. Yeah, so not from others' perspective. From psychology, other disciplines of science may have different explanation for these sleep disorders because sleep is somehow an interesting phenomenon which is not yet completely clearly explained. Nightmares, yeah, this is frightening dreams that wake a sleeper from REM. Usually it happens during REM, but then you wake. For example, if you are being chased by ghosts during your sleep, you have nightmare like this sometimes. Anyone? Then you have to awake something, right? Then night terrors, the sudden arousal from sleep and intense fear, accompanied by physiological reaction. Yeah, for example, rapid heart rate and perspiration that occurs during the slow wave sleep. Nocturnal enuresis, bedwetting. Yeah, this usually occurs in children. Yeah, when they can not yet control when they are have to pee, yeah, during before the sleep. Sleep apnea, failure to breathe when asleep. So this is actually all including snoring. Yeah. So most of the male usually, but also female, when they grow a little bit older, they develop this kind of sleep apnea. So these are some of the waveform that we have discussed during awake, during light sleep. So awake here is more of beta wave. Yeah? And there is in light sleep, REM sleep is also similar to beta with a little bit of theta wave. And this is during deep sleep. Yeah, I think this is a delta wave. Then cerebral death is when you don't have any EEG brain wave anymore. This is different EEG when you are in different condition, or physiological or emotional condition. When you are excited, you generate more beta wave in your brain. When you feel relaxed, more alpha wave. When you feel drowsy, you feel more also another beta wave. When you are asleep, you develop this kind of sleep spectrum. Yeah. When you are deep sleep, I think this is delta wave. This is delta wave. So this is in healthy patients, the EEG in healthy patients. So combination of various wave, yeah, some different wave length in different parts of the brain. Yeah, F8, C4, F7, C3 here. This is for epileptic patients who have seizures, right? Something jerking in their muscle, yeah, sometimes, yeah, and when they have epileptic. So because this burst of a signal from the particular part of the brain that creates uncontrolled motor motion like this in different parts here. Then in EEG instrumentation, typical fault that may occur, for example, when this is quite often happens, the connection between the patient and the electrode because of the broken wire electrodes and other things, cable connection problems, broken wires and bent connector pins, incorrect switch position, broken switch, faulty switch contacts, graphic recorder malfunctions, and electronic malfunction, the system itself. And artifacts due to the biological effect itself, for example, due to the motion or movement of the eye. So when the eye blinks, the eye moves, and extraocular muscle activity near on the vicinity of the eye will create also some artifacts in the EEG signal. Perspiration cause progressive reduction in time constant. There are also artifacts coming from outside the body. For example, when the patient moves or settling the electrode pops, spikes due to the momentary change in the impedance of that given electrode. So this is, for example, how the signal will look like during particular artifacts. So this EEG, then when electrode suddenly detach, so it will just drop like this. Like this, suddenly being very high. So when the electrodes are being touched by hand, then this is normal like this. This is the delta wave. Suddenly then creates some of high frequency spiking, small amplitude but high frequency spiking because of the interaction with the ions from the hand, for example. The patient move, of course, then it creates a lot of spikes in all the wave. When eyeball move like this, so like this, then there is a motion of sorts, which also creates another interesting technique called EOG, electroencephalography, technique also using electrode to measure the motion of the eyeball, EOG. Then during blinking, this is the beta wave, then you have more increased signal. Okay, that will be all for the EEG.